Welcome to Dietitian Academy, your shortcut to cracking dietitian exam. Hi everyone, I am Mohammad Shuaib, a certified dietitian with bachelor's and master's degree in nutrition and dietetics. I recently cracked AIIMS CRE Dietitian Exam with All India 4th rank in my first attempt, and now I am here to help you succeed in this RRB Dietitian Exam, which is going to be conducted in this month. This is the RRB Dietitian Marathon Series, a power-packed revision series designed to help you score around 50 to 60 plus marks directly from this content in the upcoming RRB Dietitian exam. I have carefully analyzed previous year papers, syllabus trends, and high yield topics to bring you the most expected MCQs, explanations, and tricks all in one place. Remember, every question we discuss here has a potential to appear in your exam, so don't miss a single one. Stay with me until the end. So we'll start with the first question. Which hormone stimulates the secretion of gastric acid in stomach? Secretin, gastrin, cholecystokinin, CCK, stomatostatin. The answer will be B, gastrin. Gastrin stimulates the secretion of gastric acid, which is called HCl, by parietal cell in the stomach. Question number 2. The primary site of absorption of vitamin B12 is stomach, jejunum, ileum, colon. The answer will be C, ileum. Ileum is a main site for vitamin B12 absorption via intrinsic factors, which is released from the stomach. Question number 3. Which enzyme is responsible for breaking down triglycerides into fatty acids and monoglycerides? Amylase, lipase, pepsin, trypsin. The answer will be B, lipase. Lipase breaks down triglycerides into glycerol plus fatty acids, mainly in the small intestine, with the help of lipase enzyme. Question number 4. The hepatic portal vein transports nutrients directly to heart, liver, kidneys, lungs. The answer will be B, liver. Liver receives nutrients via hepatic portal vein for metabolism and storage. Question number 5. Which vitamin is essential for the synthesis of collagen? Vitamin A, vitamin C, vitamin D, vitamin K. The answer will be B, vitamin C. Vitamin C is essential for collagen synthesis, wound healing, and antioxidant activities. Question number 6. A deficiency of iodine leads to scurvy, goiter, rickets, pellagra. The answer will be B, goiter. Goiter caused by iodine deficiencies leads to thyroid gland enlargement. Question number 7. The primary function of hemoglobin is to transport oxygen, carbon dioxide, iron, glucose. The answer will be A, oxygen. Hemoglobin carries oxygen from lungs to tissue. Question number 8. Which mineral is cofactor for antioxidant enzyme supradeoxide dismutase? Zinc, magnesium, calcium, selenium. The answer will be zinc. Zinc is a cofactor for antioxidant enzymes supradeoxide dismutase and also a copper. Copper is a cofactor for the supradeoxide dismutase. I have also discussed this in my past videos. Go and check that also. Question number 9. Linoleic acid and alpha-linoleic acid are classified as non-essential fatty acids, essential fatty acids, saturated fatty acids, trans fatty acids. The answer will be B, essential fatty acids. Essential fatty acids like linoleic acid and alpha-linoleic acids are not synthesized in the body. It should be taken from the diet. Question number 10. The RDF for protein in healthy adults per kg body weight is approximately 0.8 grams, 1.2 grams, 1.5 grams, 2.0 grams. The answer will be A, 0.8 grams. 0.8 grams per kg body weight is a recommended protein intake for normal healthy individual adults. Question number 11. Which population group has the highest RDF for iron? Adult men, pregnant women, adolescents, elderly. The answer will be B, pregnant women. Pregnant women has the highest RDA for iron due to increased blood volume and fetal needs. This question is asked in AIIMS CRE exam. So you need to remember is per day in the pregnancy case, the iron requirement will be 40 mg per day. Question number 12. The acceptable macronutrient distribution range AMDR for carbohydrate is 10 to 35%, 20 to 35%, 45 to 65%, 70 to 80%. The answer will be C, 45 to 65%. MRDA for carbohydrate in a balanced diet is 45 to 65%. I have discussed about this in my past videos. Question number 13. A diet providing 2000 kilocalorie per day with less than 10% from saturated fats aligns with guidelines for preventing diabetes, cardiovascular diseases, osteoporosis, cancer. The answer will be cardiovascular diseases. Cardiovascular diseases need a low saturated fat, less than 10% diet, helps prevent CVD issues. Question number 14. Which dietary pattern is recommended for managing hypertension? Ketogenic diet, DASH diet, Atkins diet, paleo diet. The answer will be B, DASH diet. DASH diet are rich in fruits, vegetables, low-fat dairies, which helps in lowering blood pressure. Question number 15. During prolonged fasting, the primary source of glucose is glucogenolysis, gluconeogenesis, lipolysis, proteolysis. The answer will be gluconeogenesis. Gluconeogenesis is a process where glucose is produced from a non-carbohydrate source during fasting from protein or fat. Question number 16. Which condition is associated with excessive ketone body production? Hypoglycemia, ketoacidosis, hyperlipidemia, hypertension. The answer will be ketoacidosis. Excessive amount of ketone production in uncontrolled diabetes or starvation. Question number 17. The metabolic rate is highest during sleep, rest, exercise, duration. The answer will be C, exercise. Exercise raises the metabolic rate due to the increased energy demand. Question number 18. The primary role of carnitine in metabolism is transport fatty acid into mitochondria, synthesis cholesterol, regulate blood glucose, act as antioxidant. The answer will be A, transport fatty acids into mitochondria. Carnitine shuttles long chain fatty acids to beta oxidation, so it will be very helpful in fat loss stage. Question number 19. Which amino acid is ketogenic? Leucine, glycine, serine, glutamine. The answer will be A, leucine. Leucine is a purely ketogenic amino acid, enters in metabolism via acetyl-CoA. Question number 20. Curcumin, a nutraceutical, is derived from turmeric, ginger, garlic, green tea. The answer will be A, turmeric. Curcumin is anti-inflammatory and antioxidant which is derived from turmeric. Question number 21. Resveratrol is commonly found in red wine, soya beans, fish oil, blueberries. The answer will be A, red wine. Resveratrol has a cardioprotective and anti-aging properties, so it is very beneficial for cardiovascular health. Question number 22. Which nutraceutical is known for its role in improving gut microbiota? Probiotics, antioxidants, phytosterols, omega-3 fatty acids. The answer will be A, probiotics. Probiotics are the living bacteria which is beneficial for gut microbiota. Question number 23. Lycopene, a carotenoid with antioxidant properties, is abundant in tomatoes, spinach, carrots, broccoli. The answer will be A, tomatoes. Tomatoes has a rich lycopene content, an antioxidant carotenoid. Question number 24. A low food map diet is recommended for managing irritable bowel syndrome, IBS, celiac disease, Crohn's disease, GERD. The answer will be A, irritable bowel syndrome. Low food map diet reduces symptoms of irritable bowel syndrome. Question number 25. In chronic kidney disease, which nutrient is restricted to prevent hyperkalemia? Sodium, potassium, phosphorus, protein. The answer will be B, potassium. Potassium restriction in CKD patient is very crucial to prevent hyperkalemia. Question number 26. A patient with phenylketonuria PKU with amino acid must be restricted. Phenylalanine, tyrosine, methionine, tryptophan. The answer will be A, phenylalanine. Phenylalanine should be restricted in PKU to prevent brain damage. Question number 27. Which dietary modification is critical for managing celiac disease? Low fiber diet, gluten-free diet, high protein diet, low fat diet. The answer will be gluten-free diet. Gluten-free diet is required in celiac disease to avoid villi damage. Question number 28. A patient with lactose intolerance should avoid lactose enzyme, dietary products, gluten-containing foods, high fructose foods. The answer will be dietary products. A patient who has lactose intolerance should avoid dairy products which contains lactose in that. This is mainly caused due to lactase deficiency. Question number 29. The most accurate method for assessing long-term protein intake is serum albumin, 24-hour urine nitrogen, pre-albumin, BMI. The answer will be B, 24-hour urine nitrogen. 24-hour urine nitrogen is the best method for long-term protein intake assessment, and in some cases we also use the serum albumin to test the long-term protein intake levels also. But in this case, 24-hour urine nitrogen is the gold standard for protein to evaluate the protein intake. So in this case, the answer will be question number 30. Which condition is contraindicated for enteral nutrition? Dysphagia, intestinal obstruction, cancer, diabetes. The answer will be B, intestinal obstruction. Intestinal obstruction absolutely contraindication for enteral feed. Question number 31. The Harris-Benedict's equation is used to calculate basal metabolic rate, BMR, glycemic index, protein requirements, fluid intake. The answer will be A, BMR. Harris-Benedict's equation is used to calculate the BMR. Question number 32. Refeeding syndrome is associated with abnormalities in sodium and potassium, phosphorus and magnesium, calcium and iron, zinc and selenium. The answer will be B, phosphorus and magnesium. Whenever there is a refeeding syndrome, there will be two main electrolytes which will be imbalanced, that is phosphorus and magnesium, commonly low in refeeding syndrome. Monitor it closely. Question number 33. Botulism is caused by toxin produced by Clostridium botulinum, Salmonella, Escherichia coli, Listeria. The answer will be A. Clostridium botulinum. Clostridium botulinum produces botulinum toxins, causes botulism. Question number 34. Which microorganism is responsible for fermentation of yogurt? Saccharomyces cerevisiae, Lactobacillus bulgarius, Aspergillus oryzae, Bacillus subtilis. The answer will be B. Lactobacillus bulgarius. Lactobacillus bulgarius ferments the milk to make yogurt. Question number 35. Aflatoxins are produced by bacteria, virus, fungi, protozoa. The answer will be C. Fungi. Fungi produce aflatoxins. Examples: Aspergillus species in moldy grains. Question number 36. Pasteurization aims to eliminate all microorganisms, reduce pathogenic microbes, increase shelf life without killing microbes, enhance nutritional value. The answer will be B. Reduce pathogenic microbes. Pasteurization kills most harmful microbes and helps in preventing spoilage. Question number 37. The ketogenic diet is primarily used to manage epilepsy, hypertension, type 2 diabetes, osteoarthritis. The answer will be A. Epilepsy. In epilepsy condition, ketogenic diet reduces the seizures by increasing ketone bodies, which is very beneficial in the epilepsy case. Question number 38. For a patient with dysphagia, the recommended diet texture is regular, pureed, high fiber, low sodium. The answer will be pureed. Texture modification for patients with dysphagia into pureed state is very important during difficulty in swallowing. Question number 39. Which dietary approach reduces LDL cholesterol? High trans fat intake, increased soluble fiber, low carbohydrate diet, high protein diet. The answer will be increased soluble fiber. By increasing the soluble fiber, it binds with the bile and prevents the fat digestion and helps you to excrete the cholesterol, which helps in the lowering LDL cholesterol levels. High fiber diet has a phytosterols in that, so which will help you to lower the blood cholesterol levels. Question number 40. A vegan patient is at risk of deficiency in vitamin B12, vitamin C, folate, magnesium. The answer will be A. Vitamin B12. Always remember that a vegan patient or vegan individual has a deficiency of vitamin B12 because vitamin B12 is only available in animal sources. It is not present in the plants. So for that reason, they will be on the supplements of vitamin B12. Question number 41. The Mediterranean diet emphasizes high consumption of olive oil and fish, red meat and butter, processed foods, refined grains. The answer will be A. Olive oils and fish. In Mediterranean diet, the diet is mostly consists of olive oil and fish, which supports the heart health. Question number 42. The rate limiting steps in glycolysis is hexokinase, phosphofructokinase, pyruvate kinase, lactase dehydrogenase. The answer will be B. Phosphofructokinase. Phosphofructokinase is the rate limiting step in glycolysis. And to find out every rate limiting step for every life cycle, I have shared this PDF on my Telegram channel. Go and check it out. I have clearly mentioned the cycle rate limiting steps and the important points, and I have shared the document in my Telegram channel. And if you want my personal notes, I have also shared it in my Telegram channel. Go and check it out. The link will be in the description. Question number 43. Which vitamin is a coenzyme in synthesis of DNA? Vitamin B12, vitamin B6, vitamin C, vitamin E. The answer will be A. Vitamin B12. Vitamin B12 required for DNA synthesis and red blood cell formation. Question number 44. The Cori cycle involves the interconversion of glucose and lactate, fatty acids and ketones, amino acids and urea, cholesterol and bile acids. The answer will be A. Glucose and lactate. Glucose and lactate in Cori cycle interconverts this during anaerobic metabolism, where the lactate is converted into the glucose in the liver. Question number 45. Beta oxidation is the process of breaking down carbohydrate, proteins, fatty acids, nucleic acids. The answer will be C. Fatty acids. Always remember, if the points come with beta oxidation, then it is breakdown of fats. Fatty acids is broken down into mitochondria via beta oxidation. Question number 46. Urea is synthesized in liver, kidneys, pancreas, small intestine. Urea is synthesized in the liver. That is the answer here. So, the liver is the main site of urea synthesis in nitrogen metabolism. Question number 47. A p-value less than 0.05 indicates non-significant results, statistically significant result, type 1 error, type 2 error. This type of question I have already discussed in my past videos. You can go and check it out. Here the answer will be statistically significant result. If the value is less than 0.05, then it is called statistical significance. If the value is greater than 0.05, then it is not considered as statistical significance. Question number 48. Which study design established causality? Cohort study, case control study, randomized control trial, cross-sectional study. So always remember, if the questions come with the gold standard for statistics and causality, then the answer will be randomized control trial. That is the answer here. So always remember, If the question contains a causality here, cause and effect and causality, then the answer will be randomized control trial. It is very important. Question number 49. A chi-square test is used for comparing means, assessing correlation, analyzing categorical data, estimating variance. The answer will be C, analyzing categorical data. Always remember, when you find a chi-square test is used to tell the differences between the categories. So always remember, if the chi-square test comes, then it is always the answer for categorical data. Question number 50. A 95% confidence interval means 95% of sample data falls within the range, 95% probability the true value lies within the range, 5% chance of error, results are clinically significant. The answer will be 95% probability that the true value will lies in between the range. The confidence interval is that you are confident that the data will be lying in this particular range. Okay, so the answer will be B. Question number 51. The Mifflin-St. George equation estimates protein requirement, resting energy expenditure, REE, fluid needs, glycemic load. The answer will be resting energy expenditure. Question number 52. For a burn patient, protein requirement may increase to 1.1 to 1.5 gram per kg body weight per day, 1.5 to 2 gram per kg body weight per day, 2. to 2.5 grams per kg body weight per day, greater than 3 grams per kg body weight per day. The answer will be C, 2.2 to 2.2 grams per kg body weight. Protein requirement in burn patients, because due to the high catabolism, the burn patient less than 40% burns requires around 1.1 to 2.0 grams per day. The patients who are greater than 40% burned, then they required 2.0 to 2.5 gram per kg per day. Remember this point. Question number 53. Which formula is suitable for patients with renal failure? High protein formula, low electrolyte formula, high fiber formula, standard polymeric formula. The answer will be B, low electrolyte formula. Low electrolyte formula is used in the renal failure to manage electrolytic imbalance. Question number 54. Indirect calorimetry measures oxygen consumption, urinary nitrogen, blood glucose, body fat percentage. The answer will be A, oxygen consumption. Oxygen consumption measured via indirect calorimetry to assess energy needs. It is gold standard for the energy expenditure, to calculate the energy expenditure. Always remember that. Question number 55. A patient with short bowel syndrome is at risk of deficiency in vitamin B12, vitamin C, vitamin D, vitamin K. The answer will be A, vitamin B12. Always remember, vitamin B12 requires an intrinsic factor to get digest, which is released in the stomach. In the short bowel syndrome, there is a fast discharge of food to the intestines. So here there is a deficiency of vitamin B12. Question number 56. Insulin resistance is a hallmark of type 1 diabetes, type 2 diabetes, gestational diabetes, MALD. The answer will be type 2 diabetes. Always remember, insulin resistance is a hallmark of type 2 diabetes, and autoimmune destruction of beta cells is called type 1 diabetes. Okay. Question number 57. In metabolic syndrome, which parameter is diagnostic? Fasting glucose greater than 100 mg per dl, HDL greater than 40 mg per dl in men, triglyceride is less than 150 mg per dl, waist circumference less than 80 cm in the women. The answer will be A, fasting glucose greater than 100 mg per day. Metabolic syndrome is nothing but obesity. Fasting glucose greater than 100 mg per day is the diagnosed category for metabolic syndrome. Question number 58. Cachexia is characterized by muscle wasting, obesity, edema, hyperlipidemia. The answer will be A, muscle wasting. Cachexia is a severe catabolism state. It is a key feature for cachexia in chronic kidney diseases. Question number 59. In phenylketonuria, PKU, the defective enzyme is phenylalanine hydroxylase, tyrosinase, lactase, amylase. The answer will be A, phenylalanine hydroxylase. Phenylalanine hydroxylase defective enzyme in PKU leading to toxic phenylalanine levels. Question number 60. Which condition is associated with excessive uric acid? Gout, osteoporosis, anemia, jaundice. The answer will be A, gout. Due to excessive uric acid buildup, there is a uric acid crystals in the joints, which is called gout. Question number 61. The WHO defines stunting as low height for age, low weight for height, low weight for age, high BMI for age. The answer will be A, low height for age. WHO define of stunting, which is called chronic undernutrition. It is defined by low height for age. Question number 62. The Poshan Abhiyan in India focuses on maternal and child health, food fortification, diabetes prevention, school meals. The answer will be A, maternal and child health. Poshan Abhiyan primary aim is maternal and child health nutrition. Question number 63. The double burden of malnutrition refers to coexistence of undernutrition and obesity, anemia and hypertension, diabetes and cancer, stunting and wasting. The answer will be A, undernutrition and obesity. Double burden coexisting form of malnutrition. Question number 64. Fortification of salt with iodine addresses goiter, anemia, rickets, scurvy. The answer will be A, Goiter. Goiter is prevented by salt iodization. Iodine essential for thyroid hormone function. Question number 65. The recommended age for introducing complementary foods to infant is 2 to 3 months, 4 to 6 months, 7 to 9 months, 10 to 12 months. The answer will be 4 to 6 months. 4 to 6 months is the ideal time to start complementary feeding along with the breastfeeding. Kwashiorkor is characterized by edema and fatty liver, severe wasting, rickets, xerophthalmia. The answer will be A. Edema and fatty liver. Always remember, if there is edema and fatty liver together, then the reason is Kwashiorkor. Okay, it is a severe protein energy malnutrition problem. Okay, edema and fatty liver seen in the Kwashiorkor due to the protein deficiency. In elderly individuals, sarcopenia referred to loss of muscle mass, bone density reduction, cognitive decline, vision impairment. The answer will be A. Loss of muscle mass. Sarcopenia is common in elderly, impacts strength and function. Question number 68. Which vitamin is often deficient in exclusively breastfed infants? Vitamin D, vitamin C, vitamin B12, vitamin K. The answer will be A. Vitamin D. Vitamin D is often deficient in exclusive breastfed infants due to supplementation, and it needs supplementation. In breast milk, there is no vitamin D. Question number 69. The most common allergen in children is peanuts, milk, shellfish, eggs. The answer will be B. In children, the most common allergen is milk. Question number 70. An elimination diet is used to diagnose food allergies, hypertension, diabetes, hyperlipidemia. The answer will be A. Food allergies. Food allergies identified using elimination diet by observing symptoms after reintroduction of the allergic food. So that's all for today. This is the first part of marathon series. Until the exam, there will be multiple videos coming out. If you have any doubt, let me know in the comment box. Subscribe to the channel. Thank you for watching. Study hard. All the best for your exams.